for the first poster, I'd like to welcome on stage Cynthia Ekongefeyin from the University of Zurich. We'll talk about mHealth for cardiovascular events. You have 2 minutes. Thank you very much.
Thank you for the introduction. Good afternoon, everyone. I am Sincere, and I'm the medical doctor you'll find in a clinic and also in a research hub trying to find ways we would build technologies to support people living with cardiovascular diseases. So here I'm presenting to you one of my research topics, which is a scoping review on how we are using mobile health technologies to support people living with strokes and heart attack in Africa. So 5 years ago, I lost Christy, a patient. She was a 35-year-old engineer who had diagnosed hypertension, and 2 weeks later, she died of a heart attack. Now, Christy is not alone. She refers to 1 out of every 4 persons aged under the age 70 in Africa who died from a stroke or a heart attack. Now, it's not all about birth. 1 out of every 2 persons in Africa have a mobile phone with internet, but they are not using it for their healthcare. And on a day like this, we are working to see how we can use these technologies already in the hands of the people to support them build their healthcare. So our scoping review was a systematic search of all public literature, and what we found out was that just 21 studies throughout the world has been done in Africa, and the main thing was the use of mobile phone calls and smartphone applications, and nothing about AI and all of the buzz we've been talking about here. But the learnings is that this depends on 3 things: the people, the systems, and policies. We need to train these patients, clinicians like myself, in the use of these technologies. Also, we need to build technologies that will fit in the current workflow of the typical clinician in a primary resource care setting and a limited setting. Now we need to provide evidence that will support the development of policies that will encourage the integration of these technologies. Today at GD Hub, we are celebrating this day, but it is important that all the innovators in this hall, the researchers and the universities come together to build the evidence that will support policymakers like the World Organization to build technologies that will improve the care for people with strokes and heart attack. Christy was an engineer. She died prematurely. That could be any of us here aged under the age 70. So we do not want many more Christies, and we want to save many more lives with technologies that are suited to the context and evidence-based. Thank you.
Thank you very much, Cynthia.